When you have cancer, there can be a lot of treatment decisions to make. A few years ago, after a few treatment options had failed, my doctor told me about a new clinical trial. I didn't know anything about clinical trials. My doctor explained to me that clinical trials allow doctors to test advances in medicine that may be better than current approaches to care. They help find a better way to prevent, screen, diagnose, or treat a disease or condition, and they are a great option for someone like me who was unsuccessful in other treatments.
Clinical trials study prevention, screening, diagnostics, treatment, and quality of life.
My doctor told me that clinical trials are done in phases. I was eligible for a phase 2 trial involving a small number of people. The side effects and effectiveness were still unknown for this drug at that time, so that made me nervous. But my options were limited, so I went for it.
There are 4 phases of clinical trials. Phase 1. First, the drug is tested in small numbers. If it shows promise in the lab, it moves on to the next phase. Phase 2. This is where researchers study safety and the best way to give the care in a small number of patients. This is where side effects are found. Phase 3. Only the most hopeful treatments, those that may help patients and are safe, are moved to the final phases. Phase 4. The new drug has been approved by the FDA and is safe, but further studies are performed in order for researchers to learn more about long-term use. It is important to know that if a new drug or treatment does not show that it helps to reduce disease, or if it causes troubling side effects, the research is stopped or changed.
This phased process is the only way that new medicines, tests, or techniques can be offered to patients safely. Every medicine that is offered today was once tested in a clinical trial. The phase 2 trial I was involved in followed a strict plan. I was getting the highest quality care, but I had a lot of check-ins and appointments, which at times seemed burdensome. I was very closely watched, that's for sure. It was time-consuming, and at times, the side effects were uncomfortable, but the benefits for me outweighed the risks. My doctor went over all the risks with my wife and me and answered all of our questions. It's also important to remember that this is your choice, and once you agree to participate in a clinical trial, you can stop participating at any time.
3 years ago, I was treated for cancer. I recently learned that it's recurred. It's really discouraging. So I asked my doctor if there were any clinical trials that I could try. He mentioned a new trial I was eligible for and said that my being an African American woman would really help research. It sounded like a great idea, and we were both excited about it. I like the idea of being on the front line of research, helping future patients and future generations. I told my doctor that I didn't want to be treated like a guinea pig. He reassured me that all clinical trial patients are fully informed about the study, its risks and benefits, and that I can drop out at any time. He told me that I would be treated with care and honesty and would have full control over my rights. So I only had one concern left. How much does this cost? Not only financially, but the physical and emotional toll as well. Then my doctor and I discussed the trial at length and how it would affect me. As for finances, I read that sometimes insurance covers extra costs from a clinical trial, and sometimes they don't. I got together with my patient navigator at my hospital, and we talked to my insurance company. They said everything would be covered, which is great. But it's important that you take that step and investigate costs before you agree to be a part of a trial. I've decided to enroll in the trial. I hope it helps me. But I also want to be a part of research that can help future patients too. I'll get the best quality of care, and I will be closely watched, which gives me peace of mind.
If you are considering a clinical trial, it's important that you have a detailed discussion with your doctor. Bring in a list of questions and go over them together so that you feel as informed as possible.
If you are interested in clinical trials, first, talk to your urologist or oncologist to see if you qualify for any nearby. You can also find trials through online resources. For more information on clinical trials, visit urologyhealth.org.